Hello, everyone. My name is Amanda Haukus. I'm with South Country Health Alliance. We want to thank you for joining the webinar this afternoon. Help Me Connect to Early Childhood and Family Support Resources. The webinar is presented by collaboration of Minnesota Health Plans working to improve maternal and child health in Minnesota through the Healthy Start Performance Improvement Project. These health plans include Blue Plus, Health Partners, Hennepin Health, Medica, UCare, South Country, and IMCare. The webinar is recorded and will be available for later viewing on Stratus Health website. We will have an evaluation for you to complete at the end of today's presentation, and it will appear automatically at the end of the webinar. By completing the evaluation, you will receive a certificate of participation. During today's presentation, you may enter any questions that you have into the chat box, and we will answer those after the presentation. Our presenter today is Shawn Holmes. She's with Help Me Connect. She's the Help Me Connect coordinator at the Minnesota Department of Health. Shawn leads a cross-agency team from the Minnesota Department of Health, Education, Human Services, and Children, Youth, and Families that's responsible for implementing an online early childhood navigator that connects expectant and parenting families with young children to services in their local communities. Today, she will discuss Help Me Connect to Early Childhood and Family Support Resources. Thank you, Shawn.
Thank you so much. I really appreciate the opportunity to connect with this audience and hear some of the feedback. I just, as the nice introduction, wanting everybody to know that while I sit at the Minnesota Department of Health, a lot of what I share is multi-agency efforts, and it has been something for many, many years. And I'm actually transitioning to the new state agency for the Department of Children, Youth, and Families at the end of this month. And so none of my work will change. It will always be this community effort across state, local, and community organizations. And so that's my nice little slide there. I think the one thing that I always like to share is my background is child psychology. My love of this work is because I'm a mom, and all my kids now are big. And so I think always reflecting back on me being a mom, a little displaced, but also knowing all the privileges that I may have had, and many of the families that we're serving today do not. And so how can we be the most helpful? And so we'll go ahead to the next slide, which is pretty much just an introduction as well. I think the key with the next slide is just acknowledging, again, I am doing some dual representation today with a couple of different state agencies, but the majority of what happens within Minnesota Help Me Connect is really the responsibility of any of the state agencies that support families with young children, expectant families, or family well-being services. And so I do sit here today with that hat on, but my core of being at the Department of Health is 26 plus years in the making. And so I oftentimes will revert to a public health or a healthcare type of a discussion just because of that background. And so next slide. The goal of Help Me Connect is really to share with you that this was not a quick idea. This has been actually in our minds for probably over 12 years now of how to really support families getting connected to what already exists in their local communities. We'll talk a little bit more about what that means moving forward, but we spent years listening to families in order to prepare for what this might look like. And as we sat with families and local professionals that are serving families, we asked a variety of questions. Who do they ask for help from? Who do they trust? What are they looking for? What do they have success getting in their local community, and what don't they? And as I already mentioned, one of the questions or the realities that I would often be faced with as a parent is I would find things out a year or more too late, and my child was already too old, or whatever eligibility had already passed. So what did families wish they knew about earlier? And talking with those families that may have already moved beyond the early childhood realm. We heard a lot. I actually found a slide last night as I was getting ready for this that I could have included. It was a lot of what those little voices were telling us over the years. And we have wonderful quotes from families and local providers. But the gist of it is families don't know what they don't know. They don't know what exists. They don't know who to ask for help. They're not sure of a good starting point. What if I'm not eligible for that? How can we reduce the burden on families and local providers who really are that first point of contact to help families find services? What can we do to support Minnesota families to get access to those programs? We heard loud and clear this catchphrase of one-stop shop. Can we create a one-stop shop so that I don't have to go to 5, 10 different websites to piece together this plan for families? Can we put everything that we can think of that would support families in this demographic in one area so that you as a provider or families themselves could have some trust that they could come back to this one place to get on the right track? But everything with Help Me Connect has been designed so that there is a professional impact here. There's a professional that families would feel trusting to be able to start asking questions. And if not, we're getting them to that individual. It has always been a collaboration across multiple systems. As you can see, when we're talking about systems, families will get into a public health, they'll get into a healthcare. This is the school district system. It's hard to navigate all that. So how can we at the state level bring those systems together under one umbrella so it really doesn't matter which system is what to the families that are trying to receive those services? So as I'm getting ready to launch more into this, we put together a poll. And if Jenna could bring up the poll, this is a learning opportunity for me as well. I would love to hear from you what your top 3 choices are in this. And I know this isn't exhaustive, so feel free to add more into chat. But what do you right now, what are you trying to connect families to or wish that you could connect families to? And these are some of the top choices that we see coming in to Help Me Connect. And I'll just pause here for a second so you can read through these. And then at some point, we're going to get to see some results just so we can get a feel for who's joining today, what some of the top needs are for the families that you're serving. Okay. And Jenna, how's that going? Is it looking like we can share?
Yeah, it looks like we have about half of everyone who has voted. So maybe we'll give it a couple
That's great.
Couple of seconds.
Yep. And I'm watching the chat too. So thank you, Alicia. Yes, absolutely. Where can families go for well child checks if they don't already have a healthcare provider, that they're tied to, especially with those that are coming home with new babies? It's taking on a whole new life of taking care of someone else other than yourself. And anything else in the chat, please feel free. Again, this was my first stab at trying to put together what I've heard, what I know.
All right, looks like we're about 75%. So I'm going to end the poll and I'll share results, what we have so far.
That's great. Yes. Okay. So really taking a look at some of the themes that I can resonate strongly with as I'm looking at this, basic needs is sitting at the top. Childcare, major issue going right now. Culturally specific support, that's wonderful to actually just see, to validate that for me. We're getting a variety of the early education programs. Dental, maybe I'll have some time to talk about that. That is definitely one that we've heard quite a bit about. And I see there's a couple going on in the chat here, but it's a pretty nice spread, in the top themes that I'll be able to share when we're moving forward and Help Me Connect. But I do appreciate you sharing and continue to feel free to share in the chat if you have, other thoughts about what families are needing in your particular area, in your field, in your program, but also in your area of the state. Okay, we'll go ahead and close this out and I will continue. We can go ahead and move to the next slide. Okay, so one of the probably unnecessary items to be able to share is Help Me Connect is not a program. We're not creating programs. We are only trying to get families to what already exists. And so we are a conduit to everything that we can think of at this time. And we're learning every day of what we didn't know as well. So what's going on at the local school district? Who is in the community providing dental and health care? How can families get connected to child care supports? Tribal nations, urban American Indian organizations, as well as other community organizations that are really grassroots, housed at the community level, responsible for connecting with the families that have cultural varieties, language needs, I think when I say that, yes, we are really trying to get families to what connects, but we have a data mechanism that is also telling us what doesn't exist. What are people looking for in certain parts of the state with certain demographics that aren't available right now? And is it because we just don't have it in Help Me Connect? Or is it actually true? Is it not available across the state in certain parts of the state, such as dental? Dental, we know there are deserts in Minnesota of dental care. Mental health, we don't have enough mental health providers ready to be able to take those little ones, those birth to age 5 little ones, and be able to do diagnostic assessments. And so when we learn this information with Help Me Connect, how can we inform? How can we get that back into some of our state and our policy leaders so that people know what families are experiencing? So we'll go on to the next slide, and I can start talking a little bit more about what Help Me Connect is. As I think a bit about, having this group being responsible for listening, what we started with Help Me Connect, the audience was professionals. That is who families told us that they trusted. They had one kind of a professional that they felt the most comfortable with when they didn't know where to start. Healthcare absolutely was in the top of that list. Childcare. Many families, of course, were looking at their own family, their grandparents, their aunties, uncles, sisters, brothers for more information. Faith community was a huge one that we didn't actually expect. And so who are families asking for help from? So when we launched in May of 2021, it was really marketed and heavily promoted to professionals because we knew that's where families were asking. And so how could we give the professionals another tool in their toolbox, another resource to be able to support their work? Since we've been live now, we know families are coming to Help Me Connect. Many professionals feel comfortable giving Help Me Connect, pointing to Help Me Connect, and then saying, if you have questions, if you see something you're interested in, let us know. We can talk through what we know about that program. Not all families, it's a good fit. We have families that need to have more of that relationship base and connections, the human level component, and online resource is never going to replace that. But we do know that there are many families that will do wonderfully with using Help Me Connect and explore and find what they didn't know existed. So this is really who we are really intentionally working with. And you'll find mostly it's how can we help professionals, but we go back to learning is still what are families looking for with that shorter, smaller age range, but families don't live in an early childhood bubble. And so we have information about basic needs, supports that keep that family connected together and positive support. Expectant families, including those that are bringing home fosters, adoptive little ones, kinship families, grandparents. We're hearing all of it right now about who's caring for little ones. So I added the QR code on there for those of you that want to do a screenshot. Our short URL that we use in all of our marketing is on this screen as well. Some of what I show today might look a little different if you're using a phone, but just would love for everybody to have an opportunity to be able to explore. So we'll go to the next slide. When we sat down and tried to think about what families are asking for help with, we had to give it an outline. So today we have over 14,500 different programs across the state and the 11 tribal nations. We also have some border state resources in there. We have it chunked into 11 categories. And so you can see the names of these 11 categories. You will find some of the different programs and services in more than one of these categories. And we're learning every day about the intuition, what we know that families are looking for. How would they describe that? Where would they go to look for that? One of the different items here that I'm just going to drop into the chat Oh, and it doesn't have the link. I'll put the link in here in a little bit. We have a table of contents that is able to support professionals so that if you are interested in what's on Help Me Connect, I don't have time to go and sit and try to figure this out. We have this one-page document that is downloadable from our website, and I think I just successfully put that link in there so that you can take a peek at that. Everybody asks us, how do you keep this up to date? We are looking at a variety of different ways, but we have subject matter experts. We have an annual calendar, and every single thing in Help Me Connect comes up on some cyclical review cycle. We work closely with those that are also managing data. So we work with WIC at the state level. We work with Family Home Visiting. We work with the food shelves where they're already pulling together this information and getting that added into Help Me Connect. And so the goal here is to have as timely of information available, but with anything, there is always an opportunity of making changes in real time. Something isn't correct, something needs to be updated today, or we learned about a new resource that should be added. All of those can happen intermixed here with our cyclical review process. So the next slide, I do see this quick and I will go ahead. The updates do not have the capacity. That is one of the elements that if we do find out that they don't have the capacity to serve, sometimes we may remove them from Help Me Connect, but usually we don't know. And so we might point to other resources where we know that they are trying to support capacity, such as the housing services, Fast Tracker for mental health supports. They hold capacity. Help Me Connect does not at this time. So when you click on any of these big 11 categories, you get to an exploration page. If we were to have clicked on healthy development and screening, what you will see here is an opportunity to learn more. What is family home visiting? What is follow along program? If you click on the blue headings, you will start to get to our data. That's where the data for the different family home visiting programs across the state will pull up. But I like to be able to talk about Help Me Connect as this is a way to learn what exists that you might not have known about, but you also may have an idea of what you need. And you can also go into Help Me Connect and use quick searching or a variety of quick ways of getting to that text. Each one of the 11 topics also has a helpful resources section. Really what this is links to external, typically Minnesota resources that can help providers and families have obviously just kind of a cache of different resources that they can share with families, such as you can see here for healthy development and screening. We're pointing to the Center for Disease Control's Learn the Signs and Act Early campaign. We're pointing to some positive parenting tips. We have some Minnesota specific information in here as well. So as you click through dental and healthcare, you're going to see different helpful resources along that right-hand column on those web pages. It changes with the topic. Next slide, please. So one of the nice thing, and I titled this Features and Filters for All Users, because as we grow into this presentation today, I'm going to start talking specifically about what's designed for professionals. But today, anybody can go to Help Me Connect. They can explore, they can click around and learn. Some of the nice features are we have translated Help Me Connect into 3 other languages. And so as you're clicking, if you would like to see it in Spanish, Somali, or Hmong, up in the upper right-hand corner, you're able to drop that down and to switch the language. Keeping in mind, we do have over 14,000 different little summaries about programs. That was too much for us to have translated. And so as you start to dig deeper in Help Me Connect, it does revert to English, but those top layers all have the translations. People are able to sort by location. This is key. If you start looking for information without doing your location, you're going to probably get A to Z, alphabetical listings. Once we put in a location and click search, everything in that data set resorts. So what's closest to that address is going to pop up at the top. This is super helpful with families, especially if you're thinking about families in a Twin City or a rural or an urban area where there might be 5 food shelves within a 2-mile radius. It'd be really helpful to be able to put in their exact home address so we can see what's closest to them. The other filter opportunity, which is being able to go by feature. You can see here, I just put a few. we have 20 different features, and they look different depending on what topic you're looking for. So in this particular one, I probably put in doulas. And so as we're looking at doulas, you can see some of the filters. We could go by where doulas provide services. What are their birth settings? We could filter by their specialization. We know that there are doulas that are supporting LGBTQ families. We have doulas that are supporting a variety of cultures, and we can filter which doulas are doing which using these filters that you'll find on the left-hand side. New parent baby supplies, which ones are offering diapers as part of their program, or formula, or car seats. And so just know that as you're piecing together some of your results, you can narrow that down by doing your location on the left-hand column, side margin of those web pages, and then you can do it even farther through filters. I will be showing all of this on a demo, but really wanting to just highlight some of this right now. The keyword search. Professionals often do not have time to sit and explore. Families pretty much don't either at this point in society. And so the keyword search is extremely helpful. Let me just put in what I need: autism, diapers, car seat, and click search, and it's going to show me what I want to know. I think that's where we learn the most, being in the Help Me Connect world, of what people are using with that keyword search. Next slide. So now we're starting to move more into supporting professionals. What I ask in every single presentation is that this is a give and take. We want to hear what you think. We want to know if your agency is in Help Me Connect, and if it's not, let's get it in if it's appropriate. If anything is incorrect about your agency, remember, we rely on the Department of Education to give us everything about the different school early learning programs that's going on. That might be out of date. So let's get that fixed. Let's get that set up and Help Me Connect so people have the right name and the right address. We want professionals to feel comfortable to share this with families or with other professionals. And so we have an opportunity for you to order free outreach materials. Right now, they are only in English and in Spanish, but it is really to get something that is at your fingertips if it's a good match for who you're talking with at that time. We have a variety of downloadable materials, which includes translations. It includes that table of contents. We have some fun videos, especially from a provider angle, listening to other professionals and how they're working with families and using Help Me Connect. The nice thing right now for all users, but this was really designed for professionals, was the opportunity to have an account, so that as you're creating a search, you could save it. You don't have to recreate it, especially in healthcare. If we think about the variety of school districts from the families that you might be serving, you can save a particular search for each of those school districts, so that the next time you don't have to recreate it. You can go here. Here is the early childhood screening contact in your school district. Here's the ECFE provider in your school district, etc. As I was talking about the search engine, the keyword search opportunity, I do hesitate a little bit until early February. Maybe I will be proud of how that works. Today, it is a little clunky. We do not have Google search sitting behind Help Me Connect. You have to work kind of hard sometimes to get to what you're looking for. We have a new search engine coming in early February that will really support a lot of what we're hearing doesn't work real great currently. So what I will say today, if you're using the keyword search, less is better. Let's put in one word and you're going to start to see a lot of the different types of results. And then you can start to drill down based on what some of those keywords are that you see in those results. You can then manipulate our search engine. We are going to have an interactive family assessment questionnaire. Professionals have forms. All forms. Here's an assessment form. Here's an intake form. Here's a demographic form. Well, we don't need to create another form, but also knowing that Help Me Connect is extremely overwhelming and visually. I don't know what to click on first. So is there some kind of an interactive assessment questionnaire so that as people are coming to Help Me Connect, I can just answer some questions? Do I need housing support? Yes, it's going to get me right to the housing information. I don't have to figure out where to click and where to go for that. Am I concerned about my child's development? It's going to push me right to that section and Help Me Connect so that people can get there quicker. And then we're always looking for professionals to support this. It was designed with professionals in mind, and we need to be hearing from them about what resources are most important. I'm going to share one of our biggest professional supports coming up next. So we'll go to the next slide. This is brand new. We are in the process of recruiting right now. So if this is something that, as I talk about this here and then show you on the demo, if you're interested in this, please know that you're not going to see anything on Help Me Connect today that's going to give you more information. This is very much at a recruiting, a relationship base right now with us. We created a referral system to help take the burden off of families who may have been receiving phone numbers. Here, call this, get an appointment set up. Here's where you go to get this kind of a service. And so how can we support professionals to make referrals to other community organizations on behalf of families in a secure electronic environment? And where we're at today is recruiting that first group of professionals that have a need. They have an idea in their head of who they want to make referrals to, or vice versa. Who do they want to get referrals from? And we're going to create very directed relationship-based scenarios so that that can be developed for them. We have the system created, but we need people to use it. And we want people to use it that are going to get the most benefit out of using it. So we're listening. Who do you want to make referrals to? Let's make this work for you. It is a minimal data sharing. Everything is role based. So only people that are assigned certain roles have access to information. Organizations will get to choose, do you want to receive referrals in Help Me Connect? And if you don't, that's okay. But those that do, let's help support that. Most important with this new referral system is that we have tons of referral opportunities right now, but it's really hard to close the loop. Did the family get connected? Did they get to that next step that I was hoping for? And in many situations, professionals don't find that out until a next child check, until the next appointment, and then they find out something did not work as they had hoped. That's frustrating. So how can we create a system so that that professional can get closure? They can get follow-up information. The final thing on here is really just being able to acknowledge we are working hard right now to bring in a unique first group of professionals and organizations to begin testing this. And so I'm encouraging everybody to get into contact with me. But one thing I'm going to put here in the chat is we do have an informational session that is scheduled for January 27th. And I think I got it in here. Let me put that in there. Oh, of course it didn't copy. I'm sorry. Give me 1 second here. I just wanted to put this in there right at the time level of being able to share this with you so that you had access to some more information. Of course, I'm going to have to do that probably in a second here. I'm not sure why it's not copying into the chat for everybody. So I will make sure to get that going live here. And what I wanted to be able to do is give you all an opportunity to sign up if you were interested in learning more so that you could register for this information session on the 27th. And I'll figure out the glitch there as we continue to move forward. So let's go to the next slide. I do see. Okay, I was just making sure there wasn't something in the chat. One thing is probably everybody on here, at least I hope, has heard of Help Me Grow. Help Me Grow is going to one kind of a program. It is a system for little ones that somebody has a concern about their development, about their behavior. Nothing is changing. I just want to assure that Help Me Grow and Help Me Connect are partners. It is a no wrong door approach. If you are working with the family and you have concerns about a child's development, continue to make referrals to Help Me Grow as you always have. If you happen to go to Help Me Connect first, we have the mechanism to get you to the Help Me Grow referral form, and vice versa. Help Me Grow now has information to point you to Help Me Connect, where families can then get connected to that whole variety of other services and supports. I think selfishly, there's a bit of a thought process that once a family goes to Help Me Grow, they're taken care of. And there's only so much capacity at the local school district to really be able to do that well. So let's get the family connected to what else exists, and they can work together. They can work in collaboration with one another. And the next slide. So this is the most fun part about my job, is really listening to the stories, listening to feedback, and then also sharing what we know. What is happening with Help Me Connect? What are people looking for? How are people coming in through social media or through direct links? And so this is just one slide of a snapshot of some of our analytics. Remembering we launched in May of 2021. So the little blue line that's on this line chart here, that is our monthly hit rate. And so at the very, very left side, that is June of 2021. And then we ended on December of 2024, which is our peak up at the top. You see a couple of peaks, very noteworthy. We have social media campaigns going on at those times. So we did have one in October, November of 2023, and we did just finish a social media campaign. So we have actually just hit our highest monthly hit rate. Just under 30,000 visitors have been coming to Help Me Connect each month. If we look at the whole scope of that time frame, we have had just over 650,000 unique visitors. Many come back. All of our pages, we have had 1.2 million, almost 1.3 million clicks on all of our web pages. So these are things that a Help Me Connect coordinator can be really excited to see. It's always, you hold your breath a little bit when you're looking at some of the analytics. Most importantly, I like to share the top 10. And this goes a little bit to that first poll question, really wanting to know what you're helping support families getting connected with. When we look at the top 10 of what people are putting into the keyword search in just 2024, so these flip-flop if we look at the full 3.5-year mark, but in 2024, diapers was at the very top. We had nothing in Help Me Connect for diapers when we launched. And since then, because of this, we now have a great relationship with the Minnesota Diaper Bank. We know about diaper distribution organizations. We know that there's a greater Minnesota approach now to having more diaper distribution organizations across the state. What we didn't expect was the basic needs: housing, transportation, food support, crisis needs. All of those took us out into a different area that wasn't my expertise. We've done a lot of work with adding information so that we can get people to the next best step for housing. We are not the housing experts, but we absolutely have a lot of information in Help Me Connect, and we can get people to that next step for housing. As you keep going, you won't be surprised to know autism is in there. And up until 2024, autism was always number one on our list. And so we have dropped that down a bit. But again, we didn't have any information about autism hardly at all in Help Me Connect. And we have now added more about autism assessment, autism therapy, but also pointing to the Minnesota Autism Portal. And those are more of the experts in working with the autism community and how we can identify early and get connected to services. So really paying attention to what we know people are looking for, improving Help Me Connect. I can't tell you how many times I've taken one of these terms. I've gone to Help Me Connect and I've tried it myself and I've gone, I don't like that. Let's figure out how we can make that a little bit better. And so this is one of our top priorities for being able to make improvements to Help Me Connect, is really looking at what people are looking for on this. And so I'm going to show the next slide here, because the next slide is really just sharing a story. If this story is more just to give us some context as I move in to share Help Me Connect with you and how we would use Help Me Connect to support a family that we might be serving. So we have a single mom who's pregnant. She has a 2-year-old, unexpectedly moving into Minnesota, coming from New York. And most importantly here, there is some trauma. We have a domestic violence incident that sparked this. The child coming, the 2-year-old, already has some special needs. We know the child was receiving early intervention services, and it doesn't always look the same in each state. So how can we help that family get connected in Minnesota? But mom is also, of course, living with family, very stressed, trying to figure out how to start. And so if you keep this family story in your head, we're going to go now, we're going to stop sharing this screen, and I'm going to start sharing my screen to be able to share what Help Me Connect looks like today. So we are going to share today. And let me try to pull, I have a black box at the top here, so I think we'll be okay. So this is Help Me Connect today. If you're looking at this on a phone, it's going to look a little bit different. And I'm very quick to say that because we expect families are probably looking at this on a smartphone. The white circles are not going to be there. It's going to be a red box that they can click on it as a drop-down menu. But I just like to call attention to that because I refer to these white circles frequently when I'm talking through what Help Me Connect provides. So up here, you can see this is our language drop-down. We can switch it into any of the 3 languages, click go, and the site will modify into that language. The little white circles, this is what I call quick links. I think of these as most helpful for professionals, but I'm sure everybody thinks they're quick. So if you hover over one, you can see the name of the category. It is the same down here with its little icon of a baby. If I click once, I can see what is in this category very quickly without having to click down here and read a bunch of text. So if I don't know where something is, I can click all through here and I can start scrolling and I can see what is in that category. So again, this is really quick links of being able to go right quickly to one of the content areas. Keyword search. This is where we are going to see those keywords, those top 10 that I just shared. So again, here we have diapers. This is where people are able to put in what they're looking for quickly and go right to the data. Up until now, you're not knowing that there's a huge database that sits behind it, but the keyword is a quick way to get there. We also have an About, a Help. I'm going to get to login in a second, but About gives a lot of our downloadable materials. It's where we have our order form. And Help is training for people using Help Me Connect. It's not for them to get help themselves. It's about helping to figure out, there's videos and everything on there so that you can learn more about how Help Me Connect works. We switch out our yellow alert banner, usually on a monthly basis. This is relatively new, trying to point families to the dental opportunity, the February 7th and 8th to find free dental care for those that are eligible. And then down here, this is exploration. It's the same thing as our quick links, but as you click on this, now I have a bunch of text. Now I have the helpful resources, and this is what I term exploration. So you're able to now click and you're able to learn. If I don't know information about some of these very specific headings, I can click on it and I can learn more. But if I click on birthing centers, for example, now I'm interacting with my database. Just to show you here, this is where that location matters. I already had Lino Lakes in here because I was using it before. It's going to keep your previous location in here until you get rid of it. If I get rid of it, it now goes alphabetically. I can put in another location here and click search. And now all of these birth centers are going to resort closest to Duluth. And it does look like Duluth doesn't have what's called a birthing center in it. They have birthing probably hospitals, but probably not one of those external birthing center opportunities. And so you can see the closest one now has been resorted is as far away. It's in Malacca. But just knowing that this is that yellow location field where it's super important to be able to switch whatever data you're looking at to closest where that family lives. If we put in a family's direct address, especially again in the metro area, sorry, I can't type, I think here. So we'll go ahead and we'll put in this one. Now birthing centers is showing up. So this is where this family lives. And there is one 2 miles away on Grand Avenue in St. Paul. We can click on the blue header here and we can learn a little bit more about the Twin Cities Birth Center. We can see some description. A lot of this is what they probably have also on their website. We can see where they are serving families in the metro area. We can see their location on a map, their phone number, and a variety of other pieces of information that might be helpful to share with families. As I continue to go through thinking about our case scenario, so if we had this family coming to us, we know right away that one of my first triggers would be domestic violence. How can we make sure that this family is supported with domestic violence? We can go under our family well-being and mental health, which is the heart. We can scroll down, we can click on domestic violence. Right now, I have been using Lionel Lakes just because I set up some searches for this family. If we put in Lionel Lakes and click search, we can now see that the closest one to this family in Lionel Lakes is the Alexandra House. They have chosen not to share their location because of privacy and safety issues, but this is enough information so that we can at least have something ready to support this family if this indeed becomes an issue for them and they need some support. This gives us a nice basic piece of information for supporting the family, and then we can click on the blue lines and we can learn more about that. Also, keeping in mind, this family was looking for probably early childhood, early intervention services. So if I go here to, well, let's go from the homepage on this one. If I click on, I have a concern about my child's developmental and behavioral concerns, we are able to go down here. We add that child who was 2. So we can either make a referral right to the Help Me Grow online form, or we can go ahead and we can find the local school districts so that if I needed to make sure that they had some personal touch with this, I could know who is the point of contact for the birth to 2 early childhood, special education, early intervention services. Again, one more example on this, thinking about this family, is we're really able to support, creating a list of what different kinds of services would be helpful. This is that for all users is you can create a login so that you can share your favorites, you can save your favorites. I'm going to go ahead and log in, and if you've never done it, you can register as a new user. This is giving you access to just save your favorites. This is not giving you access quite yet to do referrals. Remember, that's something we're keeping hidden here for a bit until we get our first pilot group of users, and then we're going to start making it be a little bit more prominent. But if I log in today, I now have access to my favorites. And I can see I've created one for this mom. You can call it whatever you want. I called it Mom from New York living in Lionel Lakes. I've created this document that I could share with mom, or I could just keep this for me as the provider, knowing that maybe as I have my relationship growing with mom, I can refer back to this and I can take a look at what some of those other possible connections could be. But this is that opportunity to save your favorites. I thought about all of the things this mom might need to be connected to, and I put them into this document so that I can edit this, I can use it myself, I can print it, and I can give it to mom, or I could send it to mom through an email so mom could click on all of these herself and learn a little bit more about it. The final thing that I'd like to show you is just the concept of having a professional referral system. I think the goal here is really giving professionals an opportunity to have an account. So right now I am logged in as a professional who would make a referral. And keeping with the same mindset, I created a referral earlier that is able to connect my family that I'm serving to 3 of the different organizations that have decided to accept referrals and Help Me Connect. So I'm going to show you what that looks like. Essentially what this is finding your programs, being able to attach them to a family and to share some very specific information so that each of these 3 will see information, but only that pertains to their service. So all 3 of these organizations are going to see information about mom, going to see that mom is pregnant, see that there is a little one in the home, especially for early Head Start, which could be one of the reasons why we would include information about a child. From a provider, I can tell these other community organizations anything I would want. So mom recently moved, starting over, living with family. Those 3 organizations, these 3, I want them all to know that piece of information. But then as I start thinking about what should the Alexandra House know, only the Alexandra House then is going to get this. Only when I go down here to the food shelf, only the food shelf is going to get this. The food shelf has no idea that this family is also being referred to these other 2 services. So the nice thing about this is as a professional, I have the assurances that I'm sending this. It is going to 3 organizations in this example, and those organizations are going to be able to loop back and to be able to ask questions and to tell me, did they get in touch with this family? As I close this, you can see me as this professional, I've logged in. I can see I made a referral for Natalie to 3 organization services. I can see when I did it, and I can see one of them has been picked up and 2 of them have not. And then when I open it, I can scroll down and I can go, nope, that's pending, and now we have in process, and I can get a nice gauge. And then quickly, just to show you here what it looks like from the other side, I'm using a different web browser here, so not to freak anybody out a little bit why this is going to look different. But now I'm logged in as the food shelf. And I can go in and I can see, oh, I have a referral. I received an email letting me know, and I can take a peek at that. And I can see that information that the provider intended to share with us. And I can see the little bit of information that was shared specific for Food Shelf. And I can change this and I can tell the referring provider that it's in progress. I can share notes. I can put any information in here, and that provider is going to know that I'm in contact with this family. So the one thing, as I'm knowing here, I want to leave enough time for a great amount of questions. I realized I didn't show one thing. And so let me just show the filter section really quick. I'm going to go to doulas because that was the example here that we had in the slides. So for doulas, we created with a nice variety of relationships with our Women's and Infant Health Unit at the Department of Health, an opportunity for doulas, not necessarily on the registry, to get their names out there so that people could find them. So here, this is what I was trying to show in this slide. If I were to put in Lino Lakes again, and click search, my doulas are going to resort closest to that. But now I can see specialization. And I can see out of those 98 doulas, I could start clicking on those that might meet my need better. And we can take a closer look at, for example, let's say we have I'm non-English speaking. I can now see the doulas that have actually said that is who they support. They are equipped to support that. If I look at Jill, we're probably going to see some of that special information. What I'm looking for here is to see if Jill included languages. And so we can see here, not a specific language, but there is likely some non-English speaking going on here with immigrant refugee families. So we would probably contact Jill to learn a little bit more in that case. So I wanted to make sure to not forget about the filters as I was sharing this. As I'm going to stop sharing here, we're going to go back to the slides, but I have a final poll to just really spark some of your feedback, what you found would be most helpful as you've been listening to Help Me Connect. So this poll is coming up right now. I know that I probably didn't grab everything that you might find super helpful. There might be things on here. Please share other ideas in the chat. But were there features that I did share today that you think, oh, this would be helpful. I want to learn more, or I've tried that and I do appreciate having this as a functionality in order to support the families I serve. And if you're interested in other features, or you have, comments about some of the features that I did share today, I'd love for you to just put those into the chat. And so as we get ready here to give you a couple of minutes to consider filling this out, what I would, love to have you do is also think about if you have any questions, because we'll give this a couple silence opportunity to think. And then we will start answering any questions, and we'll see what you thought of for the features. Great, thank you, Alicia. Or Alicia, sorry if I pronounced your name incorrectly. While we're doing that, I'm going to see if I can get the informational session text added somehow here. There you go. Thank you. Well, thank you, Courtney. Please don't hesitate to contact me if you have other questions because it is so new. One thing I also didn't mention is in the footer of every single one of the Help Me Connect pages is an email address. It's our general email account. All emails come to me and my coworker, Victoria, so we can streamline and get back to you as quickly as possible. You can contact, if I can figure out how to get this into the chat, I will do that. But you can contact the, here, let me see if I can get this one in there. Yeah, I can. So it's working for this. It just wasn't working for me to drop some word information in there. I apologize. So here is our general email address, and then I'm going to put in my direct so that you know exactly who you're talking to. And let me see here if I can get, if you want to go ahead and show the results, that would be great. I can take a quick peek and see if there was anything in there that, oh, great. Okay. It's looking, we did get the other. Thank you. And I do appreciate getting this because this really helps us know what you're looking for as a professional, where you might see a nice fit, a nice niche with Help Me Connect supporting your work. Also knowing that none of you probably have time on your hands to learn something new. But it is one of those opportunities that we're hoping it becomes a nice trusted tool in your toolbox over time because you have found value in it. Okay, as I continue to figure out how to get the information session link in the chat, we can open this up for questions.
I believe there was one question, Sean, about how a member might get connected to Medicaid or other enrollment in insurance.
Oh, thank you. I didn't see that one come through. I appreciate that. So again, this is one of our areas where I know it's probably not our top areas of expertise. One of the things that we have is we have access to the Child and Teen Checkup Outreach Coordinators who are really supporting families that would qualify for MA or are receiving MA to be able to find out what they are supporting and how they can get in touch with, the appropriate clinics in their area. Under our pregnant and expectant families, there is a link, there's two actually in here, that is pointing right to MNsure, is pointing right to the opportunity of being able to apply and report your pregnancy so that you can get into that process. I like to have the personal touch, of course, so I think if the familiarity is there with the person that answered or asked the question, I'm always the one that's pointing to the Child and Teen Checkup Outreach Coordinators so that there's more of a personal touch. I hope that helps. Add more into that one if I didn't answer your question. Great. By the time everybody is done thinking of questions, I will have had success with this. So
I believe there's no other new questions, but some good feedback on from some people about this being a great resource.
yeah, feel free to, we can have you unmuted. Sometimes it's easier to just talk than to try to type. Thank you, Audrey. One of the things I didn't mention is, we oftentimes will join professional association conferences. I will join regional meetings, a variety of more reactive requests of people saying, we want to learn more about this and we want to spend time on how to do the safe searches, or we want to spend time on this referral system. Can you spend time with us and just focus on some of these specifics? And so I do want to say that it's always an opportunity. You can absolutely feel free to, contact me directly or contact the general information email address. So I'm sorry, I can't figure out you guys. So I'm going to forward this to Jenna and Amanda so that maybe they can grab this text. Because I don't know why it won't drop into the chat. And I think this can be part of, maybe the resources that will come out in case we're starting to lose people here waiting for me to do this. So, but I think the most important piece was being able to let you know how you can learn more if you want to help us test and use the referral system, if you find some value in that.
Sean, if you want to send that to us, Jenna and Amanda,
Yeah,
we can add it to the follow-up email that will go out later.
that's great. So, and I am adding it right now, and we'll get that out. And that's coming to you first because I had your email sitting there.
Thanks so much.
Yeah, thank you so much. And I am still peeking at the chat. Great. And now I think people are getting ready for the final slide.
Well, again, we want to say a great big thank you to you, Sean, for presenting to us today. And thank you everyone who participated. Again, the evaluation link has been sent in the chat and it's also available once you sign off. The link to complete the evaluation will automatically appear at the end of the presentation and in the chat, which Jenna's already dropped. Completing the evaluation, you'll receive a certificate of participation. And we want to remind you that this webinar has been recorded and will be available for later viewing on Stratus Health website. And thank you again, Sean, and to all our participants.
Thank you so much.
Looks like there might be one more question.
Okay.
From Kelly Volker. Any information you can share about data privacy and/or retention on the site?
Absolutely. So, and this is really more, and hi, Kelly. This is really more about the referral system. So right now, everything is designed without the referral system where there aren't data privacy issues. Everything is public domain, public access. You're going to find it in Google, etc. So, but when we are using the referral system, we do have all of the data privacy language that can be dropped into your existing consent forms so that families have that information when they're already signing the consent forms for your program or service so that they can see exactly what type of